Hello everyone, this is Steven once again. I want to make a video today about gallbladder and gallstones and everything. How it can lead to pancreatitis. Um, a lot of times pancreatitis has a lot to do with alcoholic drinking and massive gallstones within the gallbladder itself. And even with the surgery, a massive surgery, let's say even if you're not an alcoholic and you have a lot of gallstones in your gallbladder, and the surgeon comes in to tell you the news that you have a lot of gallstones, like let's say a figure about 150 or 125, whatever the circumstances may have been, mass, whatever, and it's too big to break up. Okay, we got some news from for you, from my patient. I'd like to talk to you. Our only option is surgery. What are you gonna do? You have to remove the gallbladder. What caused it? First of all, we got to get to the main cause. Okay, what causes the gallstone itself? The same thing that causes a calcification of calcium stones, of kidney stones. And that would link it to what? Number 1A, calcium deposits. Calcium deposits goes into gallstones because it's like, okay, I put ice in the freezer. Okay, what happens when I freeze that ice? It turns hard, right? Without the freezer, it's not going to turn hard, right? You can't freeze it in the chippy ice. The same thing goes on inside your body, though. When you calculate, like calculus, you calcify. When your body calcifies the calcium, when you have an X amount of calcium inside the body, it calcifies for that time to make blockage inside the bile ducts. Okay, which in turn causes gallbladder disease, gallstones. Okay, very extreme pain, hard to breathe at your symptoms. Sometimes there's no symptoms hardly at all except for pain, nausea, vomiting. Very sorry, I lose my voice there. Okay, it causes nausea and vomiting. Okay, gallstones. Also, I'll tell you another thing I forgot to tell you. Not only does alcohol cause gallstones too. Alcoholic. Okay, my mom was an alcoholic. She didn't exactly have the gallstones, but she had what you call pancreatitis. Okay, which pancreatitis is caused by alcoholism. Okay, 1999. Okay, high fats build up in triglycerides. Triglyceride turns into calcification, turns into high fat, turns into the object of himself. I mean, it's got to go somewhere, right? If you got a big ball of fire, you got a big ball of mass of something, just setting, let's say a golf ball. I mean, if I swallow a golf ball and it goes down my digestive system, where in the hell is it going to go if it can't pass through? It's just going to stay there until a doctor operates, right? Same category, except our bodies are supposed to break down the calcium and regulate the calcium for our muscle tissue. Okay, in order for a muscle tissue to be properly right, our metabolism has to metabolize what we eat, what we drink. Like I said, what we drink, everything that we do, it has to calcify for that matter. Okay, it's a proper, almost like in calculus, math, orders of receival. Okay, like let's say, like x X is the argumental state of what the cause is. The input, what you input into the body. And then you got your F, output. The outcome of what caused the gallstones. That's just an example, okay? I'm not doing calculus because I don't have no diagrams in front of me right now. All I have is my two eyes and my hair right now. I'm just trying to give you guys like a figure here. Just like your water pump, your, I don't know, any kind of thing. Fuel pump, yeah, fuel pump, water pump, gasoline, whatever gets cut off, gets, a carotid artery, if it gets clogged, 90%, the blockage. Oops, hold on a minute, somebody's coming through here. I'm going to turn it off for a second. Okay, anyway, yeah, so basically what you want to do is, you got to watch, okay, even if you have, let's say you have the surgery, the chances of pancreatitis are very high, okay, very high. Okay, I'm not saying you're definitely going to get it, okay, not everybody that gets gallstones or gallbladder removed, your gallbladder removed, is not going to get a gallstone. All I'm saying, let's break it down this way. What causes the gallstone in the first place? High fats, high fatty foods. That's the objective here. High fatty foods cause gallstones, cause kidney stones, gallstones, pancreatitis, liver failure, okay, obstruction, gastroenteritis. I'm not trying to be a smarty pants, I'm just giving you the facts. My fingers. Okay, it's proven fact. So in order to stop these gallstones, they try to break it up. Okay, every time you're sick in the hospital, okay, and you got toxins in your body the doctor suspects, they do an IV push. Okay, called an IV push. What an IV push means is to regulate, give you water and salt water and sodium, sodium nitrate, all that stuff like that, to push it through. So you can get see if your kidneys are properly functioning, find out why your kidneys ain't properly functioning. If you have high blood pressure, they suspect, you check out your pain level, you check out to see if you need Lasix. Lasix is a diuretic that I never really used. I never told you guys nothing subject about narcotics on here. That's all I ever talk about. I'm being serious here now about something totally different that is very serious about pancreatitis. Pancreatitis can kill you guys. Okay? Anybody gets pancreatitis can die. There ain't no end of discussion about that. I'm just telling the truth. Okay? That's why you gotta keep proper diet, fiber, watch what you drink if you can. It's hard it's hard to be perfect because I know you want to have a couple of drinks on the weekend. Just don't drink and become an alcoholic every single day like my mother did, okay? That's how she got pancreatitis, guys. Listen to me. I should know this stuff. I've learned it. I've learned from the best doctors around. I learned by listening to them. Okay? 10 doctors taught me what pancreatitis was all about. I memorized it. Okay, I wrote a lot of these notes down, and that's why I know so much about pancreatitis. Okay? I know it's caused from fats, high fats, and calcium. Because if you got objects, calcium, PTH, whatever the hell, parathyroid hormones, stimulating hormones, all those other hormones, all this fancy names doesn't matter. When you put something in your body, it's got to go somewhere. Right, guys? It's got to go somewhere. If it doesn't go out, the other end, it stays in your digestive tract. And the only thing you use your gallbladder for is to help your digestive tract. A person can live without a gallbladder. But, listen to this, pancreatitis. You cannot live without a liver. Now you can get a liver transplant, a partial piece put in there, but that's if you damage scar tissue from alcoholism or blah blah blah. But anyway, there's only X amount of surgeries you can have too also, but that's different. What the basic point of this video is all about gallbladders. Kidney stones goes with it. If you have one episode of kidney stones, you're usually going to have a second ordeal happen to you later on in your life. Just like gallstones, they may have to remove it the second time, they may not. Usually use paddles. Paddles break it up. Okay? If you're lucky. But if they don't break it up, ladies and gentlemen, what I'm trying to tell you is the truth. I'm not blinking an eye, I'm not laughing, nothing like that. I'm being serious now, guys. I'm trying to make this video so educational for each and one person out there that might be suffering today with gallbladder disease. Don't think of cancer just because you have pain in your gallbladder. Get it checked promptly. Make sure you get ultrasound, whatever you need to get done, and CAT scans and everything the doctor was ordered, blood tests especially, toxicity tests, that's especially really true too. Uric acid test for acidosis, for kidney failure, end-stage kidney stage renal failure or something like that. Yeah, there we go. See, I don't have everything in front of me. I'm just trying to remember all the stuff. Okay, anyway, that's where we are right now. So, after the surgery, let's say you have your gallbladder removed, a few years down, it might take a few years down the line, let's say you're eating and then you start vomiting, okay? You wonder why you're vomiting after you eat. Ulceration, ulcer, hiatal hernia, something didn't agree with you, your gallbladder, pancreatitis. Okay, pancreatitis is an inflammation around the pancreas. There you go. Okay? So, the most common cause of pancreatitis is gallstones and alcoholism. There's two of them right there. So, ladies and gentlemen, that is about all for right now. I'm going to go ahead and upload this video so I can get it on file. Hope, pray it comes out. I hope it does. Maybe it'd be one of my better ones. So, okay, I'm going to go ahead and go on that matter, and then you go on, follow up with the doctors, and we'll see from there. More than happy to be your friends on Facebook, by the way. I love y'all guys. Okay? Okay, and I'm going to upload this video right now. So, God bless y'all. Stay healthy, okay? Take care. It's like, okay, I put ice in the freezer. Okay. What happens when I freeze that ice? It turns hard, right? Without the freezer, it's not going to turn hard, right? You can't freeze it in the chippy ice. The same thing goes on inside your body, though. When you calculate itself, and even with the surgery, a massive surgery, let's say, even if you're not an alcoholic and you have a lot of gallstones in your gallbladder, and the surgeon comes in to tell you the news that you have a lot of gallstones, like let's say a figure about 150 or 125, whatever the circumstances may have been. Hello everyone, this is Stephen once again. I want to make a video today about gallbladder and gallstones and everything, how it can lead to pancreatitis. A lot of times pancreatitis has a lot to do with alcoholic drinking and massive gallstones within the gallbladder mass, whatever, and it's too big to break up. Okay, we got some news from for you, from my patient. I'd like to talk to you. Our only option is surgery. What are you gonna do? You have to remove the gallbladder. What caused it? First of all, we got to get to the main cause. Okay, what causes the gallstone itself? the same thing that causes a calcification of calcium stones, of kidney stones. And that would link it to what? Number 1A, calcium deposits. Calcium deposits goes into gallstones because it